In 2026, millions of Americans will walk into their pharmacy. They will hand over the same prescription card they used last year. They will pick up the same bottle of pills, but for some, the price at the register will drop by hundreds of dollars. For others, they will unknowingly overpay by $500 or more simply because they didn't update their paperwork. We have all heard horror stories about the donut hole, that black hole in Medicare Part D where your coverage stopped and your wallet got emptied. Well, I have big news. The donut hole is dead. The rules for 2026 have completely rewritten the math of retirement health care. But here is the catch. The government didn't make it simple. They just made it different. In this video, I'm going to show you exactly how the new $2,000 out-of-pocket cap works. I'm going to explain the new smoothing program that lets you pay your drug bills like a utility bill, monthly instead of all at once. And I'm going to give you 5 specific moves to make this fall to ensure you aren't leaving money on the table. Do not click away. This is the biggest change to Medicare in 20 years. First, let's clear up the confusion. What happened to the donut hole? Historically, Medicare Part D had a gap. You paid a little, then you paid a lot, the donut hole, then you paid a little again, catastrophic coverage. It was a roller coaster. Under the Inflation Reduction Act, that roller coaster has been dismantled. Starting in 2025 and continuing into 2026, there is a hard cap. $2,000. Once you spend $2,000 out of your own pocket on covered drugs in a single calendar year, you are done. You pay $0 for the rest of the year. No 5% coinsurance. No catastrophic phase. Just zero. For people on expensive cancer drugs or insulin, this is life-changing. It could save you thousands. But, and there is always a but. Who pays for that savings? The insurance companies. And because the insurance companies are now on the hook for more of the bill, they are changing their plans. They might raise premiums. They might drop certain drugs from their formulary, the approved list. This means that while the cap is better, the path to get there might be rockier if you stay in the wrong plan. Here is the second massive change you need to know about for 2026. It's called the Medicare Prescription Payment Plan, or M3P. Think about it. Even with a $2,000 cap, what happens if you go to the pharmacy in January and your first refill costs $2,000? Most seniors don't have $2,000 sitting in their checking account in January. The smoothing rule fixes this. You can now opt into a program that spreads that cost over the entire year. Instead of paying $2,000 in January, you pay roughly $170 a month every month. It's like an interest-free loan from the insurance company, but you have to ask for it. It is not automatic. You have to opt in with your plan. If you don't know to ask, you get hit with the big bill up front. So, how do we save that $500 I promised? Strategy 1. The annual audit. Do not, I repeat, do not, just auto-renew your plan. Because the insurance companies are rewriting their formulas to adjust for these new laws, your good plan from 2024 might be a bad plan in 2026. Your premium might jump. Your drug might move from Tier 3 to Tier 4. You must run your drugs through the Medicare Plan Finder tool during open enrollment. Strategy 2. The therapeutic swap. Ask your doctor this specific question. Is there a generic alternative or a preferred drug on my plan that works just as well? Even with the $2,000 cap, why pay $2,000 if you only need to pay $500? Keeping your costs low helps you avoid the hassle of managing the cap altogether. Strategy 3. The pharmacy game. Plans have preferred pharmacies. If you fill your script at the big chain on the corner, it might cost $20. If you fill it at the grocery store pharmacy down the street, it might be $5. Check the network status. It sounds small, but $15 a month times 5 prescriptions is $900 a year. That's real money. Here is the bottom line for 2026. The donut hole is gone. The $2,000 cap is here. The system is safer than it used to be. You won't go bankrupt buying insulin anymore. But the system is also trickier. The insurance companies are moving the shells around to protect their profits. You have to be the CEO of your own health. Use the smoothing option if cash flow is tight. Shop your plan every October, and don't be afraid to ask for generics. If this breakdown helped you navigate the new rules, hit the like button so we can spread the word to more seniors. And click right here for my step-by-step tutorial on using the Medicare Plan Finder tool. It's the single best way to protect your wallet. I'm Walter. Stay healthy and stay wealthy.